Hey everybody, it's Professor Reynolds here, and what we're going to be doing today is talking about the various bony landmarks associated with the tibia. Now, the tibia is going to be found along your medial lower leg, and we have the proximal, or the more superior part of the tibia, and the more distal, or inferior part of the tibia located here. And we can tell the medial component based on this big bony projection found in the bottom part of the tibia, and we'll talk about that landmark in a bit. Now, if we take a look at the top of the tibia, there's a couple key landmarks that we have to identify. Taking a look here, what we can see is sort of this flattened surface known as our tibial plateau. Now, this is going to serve as the articulation point for the distal femur. And what we have to appreciate is we have a medial side and a lateral side of the tibia. So we have a medial and lateral tibial plateau. Now, between those plateau marks, what we have is this outcropping. This is known as our intercondylar eminence. Now, this prefix inter refers to between, so intercondylar means that it's going to be found between the condyles. These bony bumps at the proximal tibia would be our medial and lateral tibial condyles. So once again, intercondylar eminence, found between the two condyles of the tibia. Now, if I turn the tibia to the side, we can see this bump found at the proximal tibia. This is our tibial tuberosity. This is an important attachment point for our quadricep muscles. And sometimes people have a really developed tibial tuberosity, and that condition is sometimes referred to as Osgood-Schlatter's disease, which is caused by an excessive irritation to that bony projection. Here we have our anterior tibial crest. And as we go down towards the distal tibia, we have this bony bump on the inside part of your ankle known as the medial malleolus. Now, on the opposite side, we would have a bone articulating here. This indentation point is our fibular notch. It's named because the fibula is going to have an articulation point there. So once again, medial malleolus and fibular notch. Now, if we take a look at the posterior side of the tibia, we're going to come back to the lateral side. There's a little bit of an indentation point here. This is our fibular articular facet, and it serves as the articulation point for the proximal fibula. Last but not least, along the posterior aspect of the proximal tibia, we see this line. This is the soleal line, which is the attachment point for the soleus. And those are the bony landmarks associated with the tibia.